The United Kingdom has recorded more than 119,000 new daily coronavirus infections, the highest total of the pandemic. The number of NHS staff in England off work at acute hospitals because of COVID has risen by more than 50% in just a week. More than 18,000 staff were sick or self-isolating, an increase of more than 6,000 in the last 7 days. Joining me now live from London is Chair of the Royal College of GPs, Professor Martin Marshall. Professor, thank you so much for joining us this morning. Firstly, how is the health system coping?
Omicron is spreading very rapidly in the UK and causing quite significant problems across society, but particularly big pressures on the NHS. At the moment, those pressures are being felt primarily in general practice, in primary care and in emergency departments. Hospitals at the moment are not overrun, but we are concerned about what might happen in January when we're expecting the rapid expansion of cases of Omicron to start hitting the people who are more elderly and more susceptible to being admitted to hospital.
There's been a huge push across the UK for people to get their booster shots. Do you think that will be enough to slow the spread?
We don't know that yet. You're right that the UK governments in all four nations are putting a strong reliance on the booster programme, and the booster programme is going pretty well. From a standing start, we've now vaccinated nearly 50% of the eligible population for boosters, so that's going pretty well, and we're delivering nearly 1 million vaccinations a day on that booster programme. Will it be enough? We're not sure yet. In addition to the booster programme, there are some additional interventions in England. In Scotland and Wales, rather more strict ones. In England, mask wearing in public places and advice to work from home. But a lot of people seem to be self-policing. A lot of parties, Christmas parties, have been cancelled. A lot of restaurants and pubs and nightclubs are much quieter than you'd expect. So people tend to be self-policing at the moment. Whether we'll see strict enforced social measures after Christmas, perhaps towards the end of the week between Christmas and New Year, we'll wait to see.
You're a GP yourself. What does Omicron mean for general practice in the UK?
Well, I'm a GP in London, and we've got a massive number of cases in London. London is very much the epicentre of the Omicron epidemic in the UK. We're seeing about 1 in 30, maybe more than that, 1 in 25 people across London are now infected with the Omicron variant. That does have an impact on what we do in general practice. We're seeing most people with very mild symptoms, because most people who've got it are young at the moment, so not much worse than colds. And often we're just giving them advice on the telephone. But increasingly we're going to be seeing sicker people, and increasingly those sicker people, as it spreads to older people and people with long-term conditions, are going to need to go into hospital. So at the moment, the workload in general practice is high, but it's manageable. And a lot of our efforts in general practice are focused on delivering the booster campaign. General practice in the UK has been a very important part of that delivery system.
Professor, an analysis by UK government scientists overnight has backed up studies showing that people with Omicron are significantly less likely to develop severe symptoms. Should we take some comfort in that, or is it still too early to tell?
I think we can take a little bit of comfort, but not too much comfort. So you're right, there are studies published at Imperial in London, in Sweden, and in South Africa, all of which have suggested that whilst Omicron is extremely infectious, it might not be as pathogenic. It might not cause a severe disease as the Delta variant. The problem, of course, is because it's spreading so rapidly and because such a massive number of people are infected, you'd still expect there to be a large number of serious infections, and come January probably a large number of hospital admissions and maybe deaths as well. So I think it's very premature to be complacent about this variant, simply because it seems to be so infectious.
Professor Martin Marshall, live for us in London. We have to leave it there. Thank you so much for joining us this morning.
Pleasure.